So now we're going to take you on a visit to the Dominican Republic. And in the Dominican Republic, the first case of COVID was reported on March 1st, and an exponential increase in cases was seen after that. As of July 26th, the total number of confirmed cases was about 64,000 throughout the country. We've seen that COVID has spread quite rampantly compared to other countries where we're working, and we're monitoring the situation and working with staff and community health workers to combat that spread. The higher number of cases in the Dominican could also, compared to Haiti, could also be because of the increased testing capability throughout the country. In this video, you see a typical market in the Dominican Republic. There are differences compared to Haiti, where it's not as crowded, but as you see, some people are following guidelines and using masks and social distancing, and some are not. People wearing masks is more typical in supermarkets compared to informal markets in rural areas. MFH has been working with the Daughters of Charity in Quisqueya in communities called bateys. Bateys are communities that were set up around sugarcane plantations from workers who worked on the plantation and lived in these informal settlements. In these bateys, families are trying to distance from each other but are finding it challenging. They also have limited access to markets and health facilities due to the distance to town. MFH has run a mobile clinic with the Daughters of Charity since the early 2000s. As you can see here, patients used to gather around the clinic outside in large crowds, and the consultations were conducted inside the mobile clinic vehicle. Due to government regulations, the clinic had to close for a short period in March and April, and we worked with the daughters to make sure that we followed protocol to reopen the clinic and provide consultations. As you can see, people are outside, don't gather in crowds, and the provider sets up either out in the open or in a local community building where there can be enough space between the provider and the patient. Patients are required to wear face masks, and the provider is equipped with a face shield, a mask, and other protective equipment. After the consultation, the patient goes outside to receive their medications from the pharmacist. What you're seeing now is the walk into a CHW small pharmacy. Community health workers were supported by MFH last year to start small pharmacies that provide medications and supplies in their community rather than having to travel the long distance into town. We are working with community health workers since March and April to ensure that they have sufficient medications to treat COVID symptoms, soap, hand sanitizer, masks, and medications for chronic illnesses. The CHWs have seen increases in the number of people coming into their pharmacy each month for chronic medications, vitamins, and cold symptoms. These mothers are coming with their children for high fever and colds. In April, MFH released a training curriculum so CHWs have the resources to educate others on how COVID is spread, prevention, and home care treatment. Elisa is MFH's country coordinator in the Dominican, and she has worked with the CHWs in Quisqueya and Elias Pina, another community where we work, to educate them on COVID using the MFH materials. Most of this education was done over WhatsApp since it was not advised to initially meet. Follow-up trainings were conducted in person with social distancing protocols as seen here. We are grateful to our donors to ensure that MFH and our partners are able to provide additional resources and education during these challenging times. Elisa is MFH's country coordinator in the Dominican Republic, and she's on the phone with us today from San Pedro in the Dominican. So Elisa, thanks for joining us. Someone has asked a question. Why do you think that the virus has spread more rapidly in the Dominican compared to other countries? And just so you all know, Elisa is going to answer in Spanish and I'll translate, so just bear with us with the translation.
Buen día, gracias, Chris. Aquí en República Dominicana tenemos un poco más de acceso a lo que son las pruebas rápidas. Incluso en la provincia donde yo vivo, que es San Pedro de Macorís, tenemos 6 lugares donde se pueden tener los acceso a las pruebas, por lo que hay más facilidad en los resultados.
So Elisa says, good morning to everyone. In the Dominican Republic, there's more access to some of the rapid COVID testing or testing in general. For example, in San Pedro, where she lives, there are 6 points of testing available.
Algo también que ha influido es que la población ha ignorado el uso correcto de las mascarillas y ha violado el distanciamiento social.
Another factor is that the population isn't respecting the use of masks and social distancing as well as they should be.
Y lo que más ha impactado y ha influido en el aumento de los contagios es que en el mes de junio hubieron campañas políticas para el evento electoral.
So another factor is that in the month of June, there were quite a few political campaigns, electoral campaigns, due to the elections.
Gracias.
And thank you. So Margaret, we'll turn it over to you for the question and answer.
Okay, great. Yeah, we already have a number of questions coming in. So Enrique is wanting to know, the health facilities in the DR, are they doing PCR tests for COVID? And if so, how are people getting access?
So in the DR, our sites that are mobile clinics, the mobile clinic you saw in the video is not able to do testing, but anybody that's suspected with COVID is referred to the government hospitals and the private hospitals, for example, in San Pedro, where Elisa is, and they have testing available. So they will be sent there and test. They do have to pay a fee for it, but the testing is available there in the hospitals.
Okay. And Kristen and Lisa, maybe both can respond to this, but George Lunga from Zambia was asking a little bit. So one of the problems they're seeing in Zambia is that there are contradictory messages from government officials. And while the health protocols are very clear, political gatherings are happening and continue to take place, and that's making it very difficult in some situations for people to take COVID seriously. So he's wanting to know, is this also happening in other places, and what are we seeing?
All right, so let me ask Elisa and have her respond. Elisa, la pregunta es que, por ejemplo, en Zambia hay mensajes diferentes desde el gobierno, dicen algo y después dicen algo diferente. Y hay muchas campañas políticas allá. Quiere saber si la situación es la misma en la República Dominicana y qué estamos haciendo por eso.
Bueno, también la parte de las informaciones varían de parte del gobierno. Hoy dicen algo, mañana dicen otro, hasta el extremo que se abrió el país totalmente y luego se cerró, que es como estamos actualmente. Pero nosotros...
Espera. So the first part of the answer is that yes, the government does sometimes change. One day they'll be saying one thing, the next day they will have a different message. Also, they implemented a curfew and a closure of the country, and then they would open it and then they would close it.
Nosotros lo que hemos mantenido la información clara a través de nuestros promotores de salud, de no mantener pánico ni miedo, pero sí trabajar en la prevención a través de la higiene, el distanciamiento social y el uso de la mascarilla, evitar salir de la comunidad si no es necesario, algo que no ha dado resultado.
So what we've done in MFH and through the community health workers that we're working with in these different communities is to maintain the same messaging on prevention, ensuring that especially people are using appropriate hygiene practices, hand washing, that they maintain social distancing, use masks, and don't leave out of their homes unless it's absolutely necessary.
Thanks very much. Another question that we're getting is that someone mentioned being surprised to see the community health workers of small pharmacies interacting with the community members. And they're wondering, are they fearful of contracting the disease? Why do they continue to do this work, even with the threat?
Elisa, otra pregunta es de los promotores que están trabajando en los botiquines. Dicen que estaban sorprendiendo de ver la interacción entre la promotora y la gente de la comunidad. Quieren saber si las promotoras tienen miedo de continuar en su trabajo o qué están haciendo para ayudar en eso.
No, la promotora no tiene miedo para continuar en el trabajo. Incluso tenemos hasta embarazadas dentro del grupo de los botiquines, sí, tomando las medidas con ellas, pero no tienen miedo de continuar el trabajo. Es tan cierto que recientemente realizamos una campaña de desparasitación a los niños. Entonces, con la orientación que han recibido, ya han continuado trabajando, tomando su medida, aparte de que le hemos suplido de equipo de protección personal para trabajar con la comunidad.
So Lisa said that the CHWs are continuing their job, as you've seen. They aren't afraid of interacting with people. They are taking precautions. For example, there are some CHWs who are pregnant, so they're making sure they take extra precautions. And while they're doing other activities like anti-parasite campaigns, like giving medications for anti-parasite campaigns throughout the community, they're ensuring that they're using appropriate protocols, and they've provided personal protective equipment for all of the community health workers.
Okay, great. We've got another question related to Haiti, but I think it also applies in the DR. Can you all speak to where COVID patients are being referred to? I know in the DR, most of the UNAPs, which are the basic health centers, are closed and hospitals are open. So how is that being handled? And then further, in Haiti in particular, Kristen, there's a question about are patients from the Grand Village Clinic being referred to Mirabelec Hospital?
Great, thanks for the question. Yes, so as we mentioned in the Dominican, any patients that are seen with potential COVID exposure or symptoms are referred to the hospitals that have the appropriate testing. Also, then in Haiti, we have identified referral hospitals to test patients. So for example, in Grand Boulange, we are sending patients up to Mirabelais, which is where the Partners in Health Hospital with the government is. For testing, they have increased testing capability. They have a isolation unit, quarantine, and a treatment facility. So anyone that has major symptoms is referred up to that clinic. They are one of the only testing and best equipped hospitals in the country. So we are trying to refer others from other clinics up there, but the distance is quite an issue sometimes. But we've identified some other hospitals in Port-au-Prince that we're referring patients to as well.
Okay, well, let me just thank Kristen, Dusan, and Elisa for explaining what things are like in Haiti and the DR.